Dr. Michael Lim.
Good morning.
Good morning.
So a lot of conversation about health care, how to pay for it, the Affordable Care Act, Medicare for all, Medicare for some, Medicare for over 65. Lots of people have opinions. Doctors have been awful quiet about all of this until now.
Well, I think the thing that we wanted to talk about a little bit was, it's a changing world
Yes.
in some ways. And a recent survey came out about doctors and their opinion of their profession and what they would like to do or how long they're going to continue it. And I think the surprising thing was the vast majority of doctors, would not recommend their profession to their children. Kind of like that football conversation a couple years ago. You're not going to recommend my kids to be football players. And physicians weren't recommending necessarily to their kids to become doctors. And even though the average age of those surveyed was about 55 to 60, most of them planned on retiring within 5 years. And so the stress and the burnout rate from physicians is actually real. And this isn't the only study that has shown this. There's been a lot of change. The electronic health record, which has been mandated by the federal government, is a significant number one reason why physicians start saying, I don't like what I do anymore. Because it actually has you basically doing a lot more secretarial typing and computer order entry work than talking with people. The insurance thing keeps changing over and over again, as you brought up in the intro. So it's really hard to go through a day of seeing patients where money and finances don't become part of that discussion. And you'd like to be able to offer your patients the best possible treatments and good choices, but then those choices are significantly impacted by finances. That's real, and adds to another level of challenge. And then the concept with respect to the environment, the show me what's going on now, the social media environment world, I think does also impact healthcare and the physicians that work in it. And
Explain that.
Well, everybody wants results. Everybody wants who's the number one hospital in town, who's the number one doctor or group of doctors, who's the best, who's not the best. There's always another rating system, and this just adds pressure. So you just ratchet things up. Hospitals are not getting reimbursed more for what they do. In fact, they get reimbursed less. And so then there's a trickle-down effect because physicians are also reimbursed less for what they do. So the trickle-down effect is that it increases stress because you decrease the number of people around because you're trying to figure out how to balance the books from the hospital economic standpoint. So there's fewer people around. There's still just as much work to do, if not more. The length of stay with respect to how long a patient can be in the hospital is now targeted really hard. You gotta get this done. You gotta get this done. This patient can't stay here that long. So it becomes literally a 24/7 operation, minute by minute, hour by hour. You got to be moving, doing, it doesn't matter whether it's 2 in the morning or 2 in the afternoon in a lot of ways.
So is this different among like surgeons or general practitioners? Or even gender?
Well, so this study that we're talking about today was a little bit different in gender. So the women physicians surveyed actually were a bit happier with their jobs than the men. It is different in terms of what people do. Some surgeon specialties, and unfortunately my specialty of cardiology, tend to be up at the higher end of the burnout rate. From a physician standpoint with respect to, and just not that overly thrilled with what I do. So yeah, it does impact it.
So in this study, it says 75% of sole practitioners plan to stay independent. What is the definition of a sole practitioner?
They're hard to find these days. So a sole practitioner is somebody who basically is in business for themselves. So they're an independent provider. They can have privileges at multiple different hospitals. They likely have their own independent office where they see people, and they run their own business. It's sort of the holdover from the small town doc concept,
right.
where that person was highly important and invested in the community, and the community invested highly into them.
Right.
The fact that those are so rare is also part of why I think there's not that kind of give and take with the kudos to the physician or the feeling of satisfaction from a physician.
Do the sole practitioners feel more? Clearly, they feel more satisfied than.
They do, because they're not caught up in the big commercial rat race
Right.
of you got to do this, you got to do this, you got to do this. So it's a little bit challenging.
One of the doctors in this study who's also quoted, you mentioned it, was I didn't go to school to be a typist. I went to school to be a doctor. And when I'm typing, I'm not observing. Yeah. And I have to observe my patients so I can treat them. Instead, I'm busy typing.
Now, what goes around comes around. So, my dad was a physician, and he did not push me to become a physician. In fact, he sometimes subtly, sometimes not so subtly, tweaked me to do something different.
Right.
For very similar reasons. Change in the environment, change in the concept of how society views physicians and what that reward concept was, not necessarily from a financial standpoint, but just too much added burden and not necessarily enough reward. And that was many, many years ago. And when I was in college and when I was in, thinking about going to medical school, I worked with a lot of different physicians at that point in time, and they all told me go into business or go into something else. So I don't think what we're talking about here is absolutely brand new, and I also don't think that this is something that's that unique to physicians.
Right.
I think that this is a challenge across multiple professions.
I agree totally. It's not just newspapermen, it's radio people, it's TV people, it's plumbers, it's
so job satisfaction is challenging, and the times and the times with respect to the specific things of those challenges are specific to the profession. But I think it's one of the things we need to pay attention to.
Go back to social media, because I want you to just touch on that, because is it that the criticism of doctors and hospitals is so in your face? You mentioned social media as an issue.
I did.
What did you mean by that?
Well, I think unfortunately we take our cues from the people who are put forward most frequently in our lives.
Mm-hmm.
And so in this day and age today in our country, it's our president. And he's created and used the platform of Twitter to be divisive. Mm-hmm. And there are several people and several different groups that follow that. And from a physician, or again, pick your profession.
Right.
If you fall on the end of a diatribe from any given group of people, this is pretty demeaning and is pretty hard to swallow.
Right.
The successes and the beauty of being a doctor, having a patient have a sudden change in from feeling very poorly to now all of a sudden realizing great benefit, just getting a thank you, a smile when you walk in the door. These are small, subtle things, but very, very, very rewarding from a standpoint of why I do what I do. But then when you put on your phone and you look at, pick your social media platform,
right,
and your hospital or your healthcare system or your university is getting blown apart, it quickly takes that away. So I guess that's what I was referring to.
Yeah, no, I think that is it's really interesting because people are quick to criticize fairly and unfairly, and forget that there's another human being on the other end listening to this. And so where you would never say to this person publicly, when I receive criticism online, I usually call them, reach out to them, and say, well, boy, that was awfully mean. What did I do? And their response is, oh, I didn't even know anybody read these things. I was just having a bad day. Oh, I'm sorry. I love your show. I never really think that. It's like these people write these things, and throw this toxicity in the world, not realizing that it lands all over the place.
It does, and I think the physicians that I know in this community and the others that I've worked in, they care a lot. They really, really care a lot. They really want to do very good things, and so any type of unexpected or broadside type criticism really does hurt, and we don't have the armor or the ability to sort of protect ourselves.
99.99% of the people who get up in the morning go to their jobs to do a good job.
Yeah, absolutely.
Right. Yeah.
And so I think we need to focus more on that. I think that the main point, I guess, my message from this is, that I think being a doctor and being in healthcare remains a very, very, very important and rewarding profession. And if that's your calling, I would continue to encourage you to do it. For the young folks that are out there thinking about what they want to do. I'm not one of these doctors that say don't do it. You got to follow your heart. But we need to focus, and we need to, I think, change our daily lives into remembering the positives and the good things that happen today and are going to happen tomorrow. And those are rewards we need to look for.
Dr. Michael Lim, he's right.
Yes.
He
I
treats
love
the
it.
mind and the body. Cardiologist of SSM Health, SLU Hospital, and SLU Care. Doctor, you do great work every day. Thank you for coming in and spreading the word.
Thank you to both of you. Thanks.
8:30, Big 550.